So we have Minister Michel, Dr. Barbosa, Your Excellencies, people from embassies across the Americas, distinguished guests, thank you for being with us. Nous sommes honorés d'accueillir des représentantes et représentants des gouvernements, d'organisations internationales, des missions diplomatiques, d'organisations autochtones, du milieu universitaire, des sociétés civiles et du secteur de la santé. Ensemble, vous représentez l'ensemble des partenariats qui permettent de faire avancer la vaccination. Et je m'appelle Vera Etches. J'ai l'honneur d'agir à titre de maîtresse de cérémonie pour le lancement officiel de la semaine de la vaccination dans les Amériques 2026. I would like to warmly welcome our guests who are here in Ottawa, as well as those who are joining online. People are joining virtually from across the Americas. And your presence today reflects your commitment to vaccination, immunization, and public health, which unites us across borders. And so with that in mind, because we are so diverse, we do have interpretation devices. If you haven't picked one up already, we will be having simultaneous English, French, Spanish, and Portuguese interpretation today. I'd also like to take a moment to thank those who are the immunizers, those colleagues and partners who are here with us, and those joining virtually. Some, of course, wouldn't be able to join us today, but they are working tirelessly to promote equity and access to vaccination throughout the Americas. Avant de commencer, j'aimerais souligner que puisque nous sommes réunis de façon hybride à l'occasion de cet événement, nous nous trouvons en de nombreux endroits au Canada et dans les Amériques. Celles et ceux d'entre nous qui se trouvent au Canada se réunissent sur les territoires traditionnels des Premières Nations, Métis et Inuits. Je vous encourage tous à réfléchir de ce fait et à ce que cela signifie dans l'endroit où vous vous trouvez. Pour ma part, je tiens à souligner que je me trouve sur le territoire traditionnel de la Première Nation Algonquin-Anishinaabe. And we are recognizing the importance of Indigenous leadership, knowledge, and lived experience to advance trust and health and equity. These are core principles that are central to successful immunization approaches. And so today it's an honor to invite Elder Fred McGregor to guide us in opening today's ceremony. Thank you, Elder.
This is a very interesting time, and I was asked to come and do an opening. I had to take a deep breath, and when the organizers asked, and they said, "Can you come and do an opening?" and I says, "For which?" And they says, "For launching the vaccination of the Americas." I says, "Wow!" I says, "I don't know, but it's very interesting time, but also appreciative time." We know in the Indigenous history of the Americas as to what happened for when there was no vaccines and what was lost and what we've made up in society in order to be able to battle what we deal against. That there's a word in Anishinaabe called Gitcheokazuin, and that's the big sickness, and there's been only a couple of those. Before I start really quick is I'm very, very grateful, and this is one of the reasons that I recognize a very familiar face here, and it's Dr. Vera Etches. One of the things with Dr. Vera Etches, she was the face in COVID, and with I think there was a Dr. Tam as well for Public Health Ontario, but also Vera's. And one of the things with Vera was she emphasized the need to get the COVID vaccine. and all of this for the Ottawa area and surrounding areas, and also Dr. Tam. But what I really appreciated for Vera and Dr. Tam is that they were women, but very wise women. But the message that Vera presented, especially Vera, she reminded me of a lot of the indigenous women, and especially the Gokums and the elders, the female elders. And one of the things that I really appreciated with Vera was that when she sent her message out, she didn't make you do it. She asked you, and she reminded you, and she didn't pressure you. And when she was on key moments on TV, and this is what she would say. She would say, you know, I think it's a good idea, get the vaccine. And this is one of the things that I appreciate, is that when you were given the choice, and this is one of the Anishinaabe way of things are done, you're given this and this, make the choice. Whatever the choice you make, that you're gonna live with it, but there's going to be effects. And this is why I get a chance, because we met one time, and it was at the start of the pandemic, and we were in a large room and we had to discuss things, and we were separated, etc. And I was a bit scared. But then when I see Vera in person, handling and taking all the precautions, I said, okay, I'm in really good company. And I've seen her, so miigwech Vera, and we know where she's at now, what she's responsible for. We see today it's kind of sad what's happening. Canada in its space of, for example, measles, etc. But one of the things I just wish to share is that about a month ago, I got COVID once. I got something like COVID twice, and I got it third. And the third time, just in about a month ago, was that I lost the sense of taste and smell. But there's one of the good things is that I've known people before the vaccine. Some of them were doing their last will and stuff just to be as a precaution, and they suffered greatly. And this is one of the advice of those individuals. And she said, this is one of the females, she says, get the vaccine whenever it is, because it wasn't ready when I had it, but she says, I'm still recovering. So I did get each of the vaccines each time. The last one I got, it came in December, so I got it. So I don't think, if it wasn't for the vaccine, I don't think I would be here. This is the real honesty, and the question is, what did we learn from the pandemic? I'm not sure. It seems like it's gone away, but I don't think it's not. It hasn't gone away. It was mutated. And this is one of the things that we're here. And it said the vaccinations are a vaccination week in the Americas. I think for everyone that's out there, especially the First Nations in Turtle Island, which I'm known as Mi'kmaq-Minitig, and that's South and North America, we know what happens in the history when we didn't have the vaccines. And what it does when we vaccinate our children and we vaccinate our babies. And you see the pictures of the children. I don't know what happened, why all of a sudden there's a change. We lost our status in terms of like the measles vaccine and others. One of the things is I think we were complacent, and we teach some of these viruses and some of these things they're, lack of a better word, they're very subversive. But we don't take it as being subversive. It's like a terrorist among us. And this one, but it's what it is. It takes it. It's not discriminatory. It gets everybody. And I think this is the way we have to look at it. We eliminate things, and how come? What's scary is we go to the moon, or we went around the moon. And if we're going to go somewhere else, what are we going to do up there, or what are we going to bring back? And this is something that's, and as everyone is healthier, you have a very important job. But when we see politicians in the front and in the background, we see all our health people, and we have statements like what we saw, some of the statements, lack of a better word, Dr. Fauci, how he was almost discredited, and the need, the importance and the requirement. It's kind of sad. You do all this work and you do all of this, and then we see the numbers. So I don't know what we really learned. So what I'm going to do is I'm going to do the acknowledgement. And you're going to be sitting for a while here, but I'll get everybody to stand. If you can't stand, that's fine. Yeah, you'll be good. But so it goes like this. And for people online, it goes, and I'll translate a little bit in English, and it goes like this. You say, "Shame no way and goes tang shimi gets no go. Ningine say ningine say min. Nwam dan kakana guch kin gai chichige no shima. But mazwen kakana guch kin. Nwam dan on kin gai chichige no shima. Kange go kai test non. Kingi ken dan kai te go shima. Kin gujeta. Kan is to see on kange go, but kingi ken dan, but nwam dan on kai to no shima. Anang shuk to be keys. Kakana guch no shima. I'll get the coming on king, one down on Mazvin Kai Tonoshima. We didn't get to make it on J, Kakina and the B, Kai take or get the comic. We ain't got tongue to get to get the comic Kai Toy and Oshima, take up me, ski Kakina, good Kai Toy and Oshima. Mashkiki, Metego Kakina, and Kai Nisha Gardejik, Neo Gardejik, Masujik, Madgejik, and Kagach Notion Kangash Toshin Swam down on Botag and a Michiab to Zone on. We got Chimigachki, Nag the Wab Michnanik, Moshmagach. Chimigach on Jenny gets Simnanik, Gok Misnanik, Shumsananik, J. Deway, and a Parkin. Kan so dam wajne get sim nan igen skinway and schnabe sagas ni kwenanik we go to chimigach kakaneki guys again gi do kwa ginag jeg kan gazjik kan obukeje kan wisni siwak ye gidawi do kwa kan wanya ga kan sawaj ya bnoji shaga in residential kamarnani. I said, "I quave can sawach and quave coming on by way or a gambing. I get chingy god nani. Dinog jeg up no G shak cooking a good. I know on the Jama. Ye Nizak tonan the Kimnan, and Nagjaton on the Kimnan. Mamwe, the beach cave nan negotiation mortgage. What you can't on our king guys it again. I guess Ninga Nagajik, baby, like the Niswag Hoshima. Ninga Kanamago, Abinoji Shak, baby, Sakin, Barbie Ag, come shake on the Nissi, Wagoshima, baby, Sak. Ninga, we don't go on the Gabadnis, work, come shake. Very good, Chimigach. You can have a seat. And, it goes like this. The words I'll translate quick, just the one for English. It goes like this. I thank the Creator that I breathe and you breathe another day. We get to see another day. And the other thing is that out of nothingness, we cannot comprehend that because we do not have that comprehension yet. But the Creator created out of nothingness all that you see, created space, and in the orderly fashion of the stars, the sun, and the moon. And on this one little place that you see in the TV, you see how it's against a black background, how blue it is. This is what the space person Jeremy Hansen saw, circled around the moon to see that. How humanly we're small. And this is where we give thanks for all the waters that are here. All that has been provided. All that has been provided on Ogidkamig and Agamkam, both on top the land and below the land. We see the flora and the fauna and all the animals and all these things that are there. We give thanks for our grandparents and our elders, but also for the drum and the pipe and the teachings, and those for our young ones that follow, and for our allies that follow that. And for the other many original peoples of Turtle Island that understand what I'm talking about. We we give thanks for that. We acknowledge that for those kids that have died or murdered in the residential schools, for the murdered and missing women, and also for the women and children that come from overseas for respite as to what's happening in their areas. We give thanks for that they look after for those that are dying, that don't eat and that are suffering. And also that we look after and best as we can to take care of those little ones, that we show them what's next and that we can continue this. That we look after them, that we also look after the ones that are yet to come. There's still the little spirits that are there, that when it's grabbed and put into the human form, that we teach them all that we can and that we can protect them. And as everyone is here from across Turtle Island, North and South America, we know how important this is. We've seen what happens. We've seen what happens in 1918, 1919. We were lucky we did not have the casualty rate like in 1918, 1919. And for Anishinaabe, there's a word, which is not used very often. That's the big sickness, and we just had one. The second one, according to in the collective memory, is the 1918, 1919. I hear stories in our community about the elders that have passed on, or when they heard, and we heard how serious it is. So I think sometimes you feel left out, or you're wondering why you're doing this. Every one of you here have taken on that responsibility in the professions that you do, in the organizations that you do. The rest of the general don't understand what that responsibility is. And one of the things I would always say in my acknowledgments and my prayers when the pandemic was on, please keep Vera safe, and all those that in health, like Ms. Tam, that they can continue to be able to speak to us, to remind us how important it is to get that vaccine. And I think it was answered, because I was surprised when I saw the list that she's here. So this is the reason, but to see all of you, I give every one of you a big hug, and you do a good job. And sometimes you're not acknowledged, but you've taken that, you've taken that responsibility wherever you are, and you put that on your back, and it's not an easy, and you don't let go easy, because you see what it does. So, miigwech.
Miigwech, Elder McGregor, thank you for your kind words. Thank you for speaking about the protection that is our responsibility and how vaccination is part of that. Nous vous sommes profondément reconnaissants de votre présence parmi nous aujourd'hui, de la sagesse que vous avez démontrée en ouvrant ce rassemblement. We know that this event is focused on community, respect, and collective responsibility, and we appreciate that you're here. So Vaccination Week in the Americas is the Pan-American Health Organization's flagship regional initiative. It is now in its 24th year, first time in Canada, and it is dedicated to raising awareness about the vital role of immunization in protecting health throughout our region. The theme for 2026, your decision makes a difference. Immunization for all. It reminds us that vaccination is both a personal choice, as you mentioned, and it's also a collective responsibility. Ayant exercé les fonctions de médecin-chef en santé publique à Santé publique Ottawa, et maintenant celle de présidente directrice générale du Centre hospitalier pour les enfants de l'Est de l'Ontario, la semaine de vaccination dans les Amériques illustre pourquoi la prévention par la vaccination demeure l'un des outils les plus puissants dont nous disposons pour protéger les enfants et les collectivités. My work in public health and pediatrics has shown me just how important vaccination is, especially for the children. But from early childhood through to later stages of life, immunization helps prevent disease, reduce complications and hospitalizations, and support healthy communities. So we're going to turn over now the next probably about less than an hour or so. We'll hear how governments, health leaders, and communities are coming together to advance our shared goals. I'm very optimistic about the future, and I'm very happy to declare Vaccination Week in the Americas 2026 is open. Et j'ai maintenant le privilège d'accueillir l'honorable Marjorie Michel, Minister de la Santé du Canada. Minister Michel leads Canada's federal health portfolio, advancing policies that protect public health, strengthen health systems, and improve access to care for people across the country. Her leadership reflects Canada's strong commitment to immunization, disease prevention, and collaboration at both the national and international levels. Je vous invite à vous joindre à moi pour souhaiter la bienvenue à l'honorable Marjorie Michel.
Chers délégués, bonjour, Dr. Barbosa, bonjour. On behalf of the Government of Canada, it's an honor to host the 2026 Vaccination Week in the Americas for the first time. Won't be the last. This year's call to action, your decision makes a difference, immunization for all, is a powerful message at this precise time. Des maladies que l'on croyait enrayées depuis longtemps reviennent. Des maladies qui sont évitables avec la vaccination. Et pourtant, science is clear. Immunization is our main tool to strengthen health security in Canada and around the world. As you have likely heard, just last November, Canada lost its measles elimination status, a status we have maintained since 1998. Losing elimination status is a sobering development and a difficult wake-up call. Because in Canada, we believe in science. We value our scientists. And you know Canada has a proud history in mRNA research. Our scientists have helped lead the global development of this groundbreaking technology. But we need to take action, including building trust in vaccine through community engagement. That's key. Et je sais que c'est une des priorités de notre nouvelle administratrice en chef de la santé publique, la Dr. Joss Reimer, que je salue aujourd'hui. L'Agence de la santé publique du Canada travaille en étroite collaboration avec les autres agences de santé publique partout au Canada. Nous devons mieux comprendre les obstacles à la vaccination systématique des enfants et retrouver notre statut d'élimination de la rougeole le plus vite possible. It's absolutely crucial that we work with our provincial, territorial, and global partners, as we all need to be on the same page on vaccination. En travaillant ensemble, nous pouvons faire en sorte que nos enfants reçoivent les vaccins vitaux dont ils ont besoin pour se protéger contre les maladies évitables. Canada is firmly committed to advancing vaccination as a cornerstone of public health, both internationally and domestically. As our Prime Minister said, we are at a turning point for Canada and the world. Canada remains an active member of the WHO and a strong supporter of the global health cooperation. In fact, right now, Canada is the largest contributor for PAO because diseases do not respect borders. And as always, Canada is committed to working collaboratively with other countries to prevent and respond to global health threats. Thank you to Dr. Barbosa and everyone in the Pan-American Health Organization for promoting equity and access to vaccination across the Americas. Je sais que nos efforts communs produisent des résultats concrets au Canada et dans toute la région. Because working together save lives and keep Canadians safe. Thank you. Merci beaucoup.
Merci, Ministre. Thank you for underlining that science is clear and pointing to the importance of research as well in advancing immunization, et aussi le point que c'est important que nous travaillons ensemble. I'm now honored to welcome Dr. Jarbas Barbosa, Director of the Pan-American Health Organization, to the podium. En tant que directeur de l'OPS, Dr. Barbosa assure le leadership régional en santé publique dans les Amériques. Il est un ardent défenseur de la vaccination, de l'équité et de la coopération pan-américaine afin d'améliorer les résultats en matière de santé dans l'ensemble de la région. Alors, so please join me in welcoming Dr. Barbosa.
Thank you. Good morning. Bonjour. First, I want to apologize because I will not. I will only speak in English. Sorry, but I need to overcome this barrier because I can communicate in 3 out of the 4 official languages of the Pan-American Health Organization. But next time in Canada, I will deliver my words in French. It's a promise. Honorable Minister Marjorie Michel, distinguished health authorities that are here, colleagues, representatives of civil society and non-governmental organizations, special guests, ladies and gentlemen, I want to also to recognize the elder that said so wise words that really a reflection about what you need to learn from this dramatic experience that was the pandemic. Thank you very much for that. It's an honor to address you at the launch of the 24th Vaccination Week in the Americas, an initiative that since 2003 has united our region around a shared purpose, protecting lives through immunization. This effort transcends borders and systems. It reflects a core conviction. Health is a public good that must be built and protected together. I would like to thank Canada for hosting the regional launch for the first time and for its continued commitment to strengthen immunization, including the effort to restore the region's measles-free status, which was lost in November 25. We also recognize Canada's rapid and effective response to the recent measles outbreak through high vaccination coverage, strong surveillance, and clear communication to counter misinformation. These are the foundations of resilient health systems. This year, we reaffirm a simple message. Your decision makes the difference. Immunization for all. Because vaccination is not only a personal choice, it's a collective act of protection and solidarity. When coverage is high, communities are protected. When gaps appear, diseases return quickly and with serious consequences. We are at a crucial moment. During the COVID-19 pandemic, the region achieved the fastest vaccine rollout in history, proving what is possible when science, political will, and solidarity align. Yet today, immunization needs to get more visibility and urgency. Although recovery has begun, gaps remain. Between 2022 and 2024, around 5 million children in the Americas missed the routine vaccines, particularly among poor families, indigenous peoples, Afro-descendants, migrants and refugees, all that are facing barriers to access health services. This situation is not acceptable, but is within our reach to overcome it. At the same time, misinformation continues to undermine trust and informed decision-making. Addressing this requires not only data, but also listen to the doubts and to the asks of the families and communities. It also requires empathy and clear communication. In this context, I want to recognize the extraordinary work of health workers across the region, physicians, nurses, vaccinators, community health workers that are the backbone of immunization systems across the Americas. They turn policy into protection, build trust, and ensure vaccines reach every community. Their work saves lives every day. Trust is the foundation of the vaccination program, and health workers must be supported with the knowledge, skills, tools, and confidence to engage communities and families and address concerns effectively. The region has long been a global leader in immunization, but progress requires vigilance, investment, and a firm commitment to reach everyone, everywhere. From this perspective, we are advancing 4 interconnected priorities. We are expanding routine childhood vaccination, especially against measles. The Americas have eliminated measles before, and we can do it again, but only with sustained coverage above 95%, not only as a national average, but in every province, state, city, community. Elimination is not a one-time milestone. It's a continuous commitment. We are moving toward the elimination of cervical cancer too, with HPV vaccination as a central pillar, broadening coverage and ensuring clear, culturally appropriate information for families so that the next generation of girls can grow up free from this preventable cancer. We are reinforcing regional vaccine manufacturing and food procurement through the Pan American Health Organization Regional Revolving Fund, so that safe, high-quality vaccines remain affordable and accessible to all countries in Latin America and the Caribbean. At the same time, we are embracing innovation, introducing new vaccines, new strategies, new technologies in an evidence-based and sustainable way, fully integrated into primary health care across the life course. Sustainable investment will determine how far and how fast we go. Immunization is one of the smartest investments in health. When it declines, systems weaken and diseases return. As we launch this vaccination week, let us renew our commitment. Keep immunization a sustained budget priority every day, not only times of crisis. Reach zero-dose and under-immunized populations, leaving no one behind. Strengthen clear and transparent communication with families and communities while confronting misinformation. Let every day be an open door, every conversation a chance to build trust, and every vaccine a step forward toward a healthier future. Together, we are stronger than any threat we face. Thank you, merci, gracias, obrigado.
Thank you. Health is a public good that we must protect. And thank you, Dr. Barbosa, for drawing attention to the populations facing some of the greatest barriers. We will let the Minister and Dr. Barbosa take their seats because nous avons maintenant quelque chose de très spécial à vous proposer. Témoignant du ferme engagement de leur pays en faveur de la vaccination, les ministres de la Santé du Chili, d'Haïti, du Honduras et du Mexique ont préparé des messages spéciaux à notre intention au nom de la région centrale de l'OPS. Alors, écoutez maintenant leur réflexion sur le thème « C'est votre décision qui fait la différence. Vaccination pour tous ».
Reconocemos la importancia del lanzamiento de la Semana de Vacunación de las Américas, impulsada por la Organización Panamericana de la Salud.
Una oportunidad muy importante para recordar el valor que tiene la vacunación en la vida de las personas y en la salud de nuestras comunidades.
Depuis plus de 20 ans, cette initiative panaméricaine demande qu'en travaillant ensemble, les pays des Amériques peuvent prévenir les maladies évitables par la vaccination.
La vacunación no es únicamente un servicio de salud, es una expresión de solidaridad social para proteger lo más valioso que tenemos, nuestra población.
Las vacunas han salvado más de 154 millones de vidas en los últimos 50 años. Son, sin lugar a dudas, una de las herramientas más efectivas y trascendentales de la salud pública, capaces de proteger generaciones, preservar vidas y garantizar el futuro de nuestra nación.
Un message qui appelle que chaque décision de faire vacciner un enfant contribue à protéger non seulement chaque citoyen, mais aussi l'ensemble de la communauté dans un contexte régional marqué par la résurgence des cas de rougeole.
El sarampión está reapareciendo en distintas regiones del mundo. Este hecho nos recuerda que no podemos dejar de trabajar en la prevención.
Por ello, en México hemos intensificado la vigilancia epidemiológica y fortalecido nuestras estrategias de vacunación.
En Chile, la vacunación es una de las herramientas más importantes de la salud pública. Nos permite prevenir enfermedades, evitar complicaciones, reducir hospitalizaciones y proteger de manera oportuna a la población.
Honduras avanza con firmeza en la protección de la vida. Contamos con un esquema nacional que incluye 24 vacunas que nos protegen contra 27 enfermedades y garantizamos vacunación gratuita para toda la población sin distinción.
En Haïti, cette semaine révèle d'une importance particulière. Malgré un contexte marqué par des défis sécuritaires et humanitaires majeurs, le ministère de la Santé publique et de la Population considère la vaccination comme l'un des programmes prioritaires dont l'accès et l'utilisation continuent d'être garantis pour protéger la population contre les maladies évitables par la vaccination.
En México estamos trabajando todos los días para que estas dosis lleguen a cada rincón del país, desde las grandes ciudades hasta las comunidades más alejadas. El objetivo es garantizar que la salud sea un derecho equitativo en todas las etapas de la vida.
Como Ministerio de Salud, hemos seguido fortaleciendo este trabajo, con foco en la prevención, en la equidad y en el acceso oportuno, para que esta protección llegue a quienes más lo necesitan y en el momento adecuado.
Vacunar es un acto de amor y de responsabilidad que trasciende fronteras.
Elle protège les individus, renforce les communautés et contribue à la stabilité et au développement de nos sociétés.
Vacunarse es protegerse, pero también es cuidar a los demás.
Bajo el lema de tu decisión marca la diferencia,
Junto a la Organización Panamericana de la Salud, hacemos un llamado a nuestra región a cumplir con sus esquemas de vacunación. Tu decisión marca la diferencia.
That was just so encouraging to hear the commitments that were made in this room echoed across the Americas. I took away a couple of phrases that also stick with me. Vaccination is an expression of solidarity and an act of love. Maybe this will become a new sign of I love you. Okay, so at this point, I'm going to welcome up Dr. Danielle Salas. As Executive Manager of PAHO's Special Program for Comprehensive Immunization, Dr. Salas will guide us through a diagnostic of the current situation in the Americas region. And Dr. Salas leads PAHO's regional work to strengthen immunization systems across the Americas, supporting countries to prevent outbreaks, address misinformation, and ensure equitable access to safe and effective vaccines. His expertise and leadership play a key role in advancing vaccination as a cornerstone of public health in our region. Please welcome Dr. Daniel Salas.
Well, thank you. Thank you very much for accepting Canada being the host of this important ceremony. And now I'm going to talk about immunization in the Americas, a brief overview. And as you may know, the Americas has been leading the elimination efforts in the world. And this is our history of success. And actually, we were the first to eliminate each one of those diseases. And for measles, unfortunately, I mean, we know because of the high communicability that measles has, it's quite difficult to sustain that elimination. You see that we got the first elimination status in 2016, but then we lost it 2 years later. And then we recovered it in 2024, but then we lost it again the next year. So, of course, that is one of the most challenging diseases to sustain the elimination. And you see here that we are regaining coverage, but however, it is not enough. And we were declining coverage probably since 2015 in the Americas. But during the pandemic, this got deeper, the decrease in the vaccination coverage. And you see there is a chart or a graphic on your left side that the minimum acceptable level that we have for measles is 95%. We need to achieve at least that percentage of coverage, and we are not achieving that. Not for the first dose, neither for the second dose. So we need to have to make a bigger effort to get there. And you see there that we are in 89% last year and 79% for the second dose, 89% for the first dose. But we need to sustain that, because if you don't do that, then you start to add up, to accumulate pockets of susceptible people. So it's not about the last year, because of course we are succeeding on improving our vaccination coverage, but we are not still accepting those coverage as good enough. And you see at the right hand the map of the Americas, where you can see that this is not uniform. And of course, we aim to achieve the 95% at least, but we need to do that even within the countries. Because if we could have a map of each country and what is going on inside, you could see the heterogeneity that we have, in many municipalities and many subnational levels for these. And of course, that situation of having not optimal levels of coverage, and of course, having not strong enough surveillance systems and rapid response assembled, then that has led us to have the reemergence of measles in our continent. And you see there, it's quite graphically very clear to see the difference that we had in 2024 when we had 466 cases the whole year. But then you see the jump that we had in 2025. And now, just in these 4 months, we have surpassed the numbers of cases that we registered in 2025. So it's important to note, of course, the importance. You see there's one bullet on the right-hand side that says the Americas' share of global cases climbed from 5.9 in 2025 to 21% in this first Q of 2026. And actually, that bullet serves as a reminder that measles is circulating, across all the world. And of course, the risk of getting measles is not just in the Americas. We can have an importation from each region in the world, and that importation if it finds these pockets of unvaccinated, it's going to start a chain of transmission. And you see there that unfortunately we have had 44 deaths, and 89 of the cases were non-vaccinated. Most of them are non-vaccinated, and small percentage, the number is unknown. We have, as of today, 15 countries that are having active outbreaks of measles. And then we have some of the current issues favoring low vaccine uptake. Of course, I mean, we can divide these in several ways, but definitely gaps in health systems and equitable access is one of them. Then we have this situation that Dr. Barbosa mentioned, the vaccine hesitancy and misinformation. And of course, this is like quite important now that we have a mass use of social media, and we need to revert that kind of use of social media to favor, people informed, people that are getting good quality on their information. But of course, the disruption from the COVID-19 pandemic is still affecting us. That has led us to have more pockets of unvaccinated that is feeding up these resurgence of measles and other diseases. And of course, the variability in political priority and investment. So we need still to work a lot to try to strengthen, to reinforce. We know that some of these factors are very influenceable by what we do. So we need to keep the work going on. And so I'm going to refer to some of the strategic priorities, not trying to address all of those, factors that I already presented, but mainly when we are trying to close in the gaps in health system and capacity and equitable access, it is important to strengthen the primary health care, that first point of contact that we have in our communities so that people might have better conditions in their health. And when we talk about primary health care, it's not just about talking about the first level of attention. It's talking about that community engagement that we need to have, that social participation, that kind of living health wherever that you go in your community. And that's part of it. And of course, service delivery, but also to expand outreach to underserved populations. Because as you see the logo, Vaccination for All, we need to make that a reality. And the problem is exactly what Dr. Barbosa was mentioning. All these populations are left behind continuously, year after year. So that's what we need to do, try to do outreach to them. To invest in skilled, sustainable healthcare workforce, also to leverage data and digital tools for targeted action. And now we're really trying to make an effort to support the implementation of electronic immunization registries in the countries of the Americas. Because, we have the technology to do that, but it requires, of course, the commitment from the political part and all the internet available, of course, the equipment and all that. And then we have the addressing vaccine hesitancy and misinformation. So we need to continue building trust through clear, consistent communication, and we need to listen. We need to listen to people. Why are they doubting about vaccinations? It's part of how to understand them and to have a tailored strategy to address their doubts, which of course is going to be different depending on the context. And to engage communities and trusted partners always, this is very important. It's not about healthcare sector or the health sector by it alone. We need to have this kind of networking to make it effective. And monitor and counter misinformation, which of course is important. We need to listen what is going on, and the health authorities, it's important to have this kind of how to counteract when there is a false information spreading that can cause really, a lot of problem on the trust on vaccines and other topics. And of course, to promote positive experiences and champion voices, because in this world, sometimes or many times, we're listening to news that, tend to be negative. So we need to counteract that and have these champion voices as well. We need to identify which are the people that can be an example for our young people, for everybody, depending on exactly who we want to address, and for them to raise their voices to be championed and to represent the importance of vaccination as well. So, merci de votre attention.
So certainly heard there that we're not accepting this status quo as good enough. And there are very easily identifiable strategic actions we can take to increase vaccine uptake. Now we have another special speaker. J'ai le plaisir d'inviter Dr. Joss Reimer, administratrice en chef de santé publique du Canada. Dr. Reimer brings to this role a strong commitment to prevention, public trust, and collaboration across jurisdictions. We will hear from Dr. Reimer today about how this launch of Vaccine Week in the Americas is underscoring the central role that immunization will play in her leadership and her priorities as Chief Public Health Officer for Canada. Dr. Reimer.
Distinguished colleagues, partners, fellow health professionals, and guests who are joining us both from across Canada and from the Americas. Good morning, buenos dias, bonjour. C'est un privilège d'être ici aujourd'hui pour le lancement de la semaine de la vaccination dans les Amériques, qui coïncide avec la semaine nationale de promotion de la vaccination ici au Canada. Ce moment revêt une importance particulière alors que j'assume mes nouvelles fonctions d'administratrice en chef de la santé publique du Canada. You mentioned that this is an important topic for me, and it's actually a deeply personal topic for me. In Manitoba, I was responsible for the COVID-19 rollout, but I also grew up in a rural community that at one point in the last 2 years had the highest rate of measles in the Americas. And so this is something that has been deeply personal throughout my life, the importance of vaccines and the impact when we don't have the rates that we need. And today's event unites the Americas region across one of our greatest achievements in public health, a cornerstone to public health, and an opportunity to recognize the impact of vaccine. It's a tool in maintaining good health across the lifespan, in building healthier and more resilient communities. In Canada, adult vaccination is estimated to save about $514 million in healthcare costs and add $1.9 billion in productivity benefits each year. De cara al futuro, es probable que la vacunación tenga efectos cada vez más positivos en nuestra salud a medida que siguen surgiendo innovaciones en las tecnologías de vacunación y nuevas vacunas. Hoy día, podemos, por ejemplo, observar los efectos positivos que tienen los programas de vacunación contra el VSR en la protección de las personas que se encuentran en mayor riesgo. At the same time, the environment is becoming more and more complex. The spread in mis and disinformation continues to challenge vaccine confidence. Strengthening public trust depends not only on scientific advancements, and it was very encouraging to hear the minister talk about the importance of science in Canada. We need to ensure that people have the information that they need to make informed vaccination decisions for themselves and their families. And to that end, we will continue to work through the national immunization strategy, as mentioned by the minister, to strengthen vaccine confidence and uptake. We will build upon the strengths of Canada's rigorous regulatory system and the robust infrastructure in place to monitor vaccine safety after approval. Independent expert advice also plays a key role in public confidence. Canada's National Advisory Committee on Immunization will continue to provide ongoing evidence-based guidance to support immunization recommendations, ensuring they reflect both the scientific evidence and Canada's unique public health context. We've talked already about the ongoing multi-jurisdictional measles outbreak and the loss of elimination status, and how this is a stark reminder of our continued vulnerability to disease outbreaks and the need to stay vigilant. The majority of measles cases have occurred in under-vaccinated, highly connected communities like my hometown, with limited spread beyond. So this reflects both the risk of low vaccination coverage when it is concentrated in communities, but also the strength of broader population immunity. Canadá se ha comprometido a poner fin al brote actual y a recuperar el estatus de eliminación. Nuestro objetivo es aplicar las lecciones aprendidas de este brote para fortalecer nuestro esquema general de vacunación mediante iniciativas de colaboración y implementación del Plan de Acción contra el Sarampión para Canadá. Como parte de este plan, mantenemos un diálogo constante con los socios que colaboran en la lucha contra el sarampión en la región, entre ellos la OPS, Estados Unidos y México, demostrando colaboración para la eliminación mundial de sarampión. As we saw during the COVID-19 pandemic, the success of vaccination programs relies not just on access, but on people's willingness to be vaccinated. And here, trust is key. Trust is shaped through experience. It's based on whether institutions and systems are seen as competent, effective, caring, and transparent. Tackling mis and disinformation requires communicating credible, evidence-based information and building trust through culturally safe and positive healthcare experiences. And on the front lines, we know that health professionals are consistently viewed as the most trusted sources of vaccine information. So this week provides a special opportunity to recognize and thank health professionals from across the Americas for their continued work in ensuring supportive access to vaccinations. Au Canada, la vaccination est une responsabilité partagée entre les paliers du gouvernement, les professionnels de la santé, les partenaires autochtones et les organismes communautaires qui travaillent en collaboration pour promouvoir et administrer la vaccination. Aujourd'hui, alors que nous nous réunissons pour réfléchir à la vaccination et renouveler notre engagement en sa faveur, la voie à suivre est claire. Sustaining our collective success requires continued engagement, strong systems, a focus on building and maintaining public confidence in vaccines across the lifespan. So today, I hope that all of you join us as we champion this year's call to action. Your decision makes a difference. Immunization for all. Thank you. Gracias. Obrigada. Merci. Miigwech.
Thank you, Dr. Reimer, and for pointing, I think the first time we had this point made today, to the economic argument, the healthcare costs saved, the lost productivity also that is avoided with vaccination. Thank you for repeating Canada's commitment to collaboration across the Americas and doing so in multiple languages. I'm now going to say, it's just about the end. Nous arrivons bientôt à la fin de notre programme officiel, and we are going to be joined by the Silla Throat Singers, but Paho has prepared a special message to us all. So we'll just change the setup while we listen.
Behind every protected life, there is a story of care and informed decisions made at the right time. Across the Americas, decades of effort and collaboration have safeguarded the health of entire generations. Thanks to vaccines, we have achieved what once seemed impossible: eliminating polio, preventing more than 6 million deaths from measles in the last 20 years, and saving countless lives.
El sarampión es una enfermedad causada por un virus.
However, today we face challenges we thought were behind us.
La Organización Panamericana de la Salud emitió una nueva alerta epidemiológica de sarampión.
Measles has returned. When vaccination coverage declines, vaccine-preventable diseases come back. Vaccines are one of the most cost-effective interventions to protect our health and that of our families. In 2026, we celebrate Vaccination Week in the Americas. Recognized as a regional public good, it renews our shared commitment to strengthen immunization and prevent setbacks that affect the development of our countries. To healthcare professionals, thank you for giving your all to protect our lives. History has already shown us that together we can do it. Your decision makes a difference. Immunization for all.
Nous avons maintenant le grand privilège d'avoir parmi nous les chanteuses de gorge Silla. The inclusion of Indigenous songs in a gathering such as this honors the living cultures, traditions, and communities that continue to shape the land on which we gather. It reminds us that health and well-being are deeply connected to identity and belonging. Inuit throat singing in particular carries deep cultural and historic significance. Its revitalization in Inuit communities is an act of resilience and cultural continuity. Aujourd'hui, le chant de gorge soutient non seulement l'expression culturelle, mais aussi le bien-être mental, émotionnel et communautaire, en renforçant les liens, l'identité et les transmissions intergénérationnelles des savoirs qui sont au cœur de la santé publique. So it is with respect and gratitude that we now welcome Charlotte Kamenik and Cynthia Pitsiulak, the Silla throat singers, to the stage. I invite you to join us.
Hi, everyone.
Hi, unusakut.
Charlotte, angogata kamanak mi anakak kano atakak dunga igluring mi utakseo gama.
Hi, I'm Cynthia Pitsiulak. I'm originally from Kimirut Nunavut, and I live here in Ottawa. We're throat singers, Inuit throat singers.
I'm originally from Igloolik, also living here in Ottawa. We know you guys have been sitting and it's very warm, so we're just going to get right into it. Thank you, thank you. Do you guys have a patience for one more song?
Also, it's really normal for one of us to start laughing. So in case you find it a bit strange, it's totally normal.
We're using our voice, our breath, and our throat to create sounds that interpret nature, animals. Some songs are competition songs to see who can outlast the other. There are lullaby songs. And we're not singing at the same time. There's a leader and a follower, and the leader sets the tone, the rhythm, and the pace of the song, and then the follower has to do exactly what the leader does the second they do it. And so that's the game. And then the follower can also steal the lead and become the leader and they have to become the follower. So it's a fun game that's been played by Inuit for thousands of years.
All right, that will be all for now.
Thank you so much. If you want to learn more about who we are and where you can find our music, our duo is called Sila, S-I-L-L-A. We've got music on all platforms and silathroatsingers.com. Thank you.
Thank you. Kuyanamik.
Kuyanamik. Kuyanamik, what a joy. And thank you for pointing out that Inuit throat singing can't be done alone. It requires collaboration, just like our vaccination effort requires collaboration. So we are coming to the close of today's formal program, and I just want to offer a few thanks. Today's launch of Vaccination Week in the Americas 2026 has reminded us that immunization is not only a cornerstone of public health, but it is a shared regional commitment. It's one grounded in that collaboration, trust, and care for one another. Je souhaiterais adresser mes plus sincèrement remerciements à nos conférenciers et à nos partenaires, provenant du gouvernement du Canada et de l'Organisation panaméricaine de la santé, dont le leadership et l'engagement continuent de faire progresser la vaccination et l'équité en santé dans les Amériques. Merci également aux pays qui ont exprimé leur point de vue par vidéo, ainsi qu'à toutes les personnes qui ont contribué à la réalisation de cet événement. So to those joining us virtually from across the region, thank you for being a part of the important moment. Your participation does reflect the strength of the Pan-American community and the collective effort of Vaccination Week. So I'm going to invite our in-person participants to stay with us. There's a little informal gathering and networking for the next while. And as we conclude, I would like to ask Elder Fred McGregor back to offer closing words.
Yes, I was told by one of the organizers, can you make the closing really quick? Just says, yeah, it's usually quick. It's going to be real quick, so I was going to say, Die Mam do se men Mam in which be madzi ang and Mam in which kwe na ne goshma and ki di gans je goshma gut so onage go which be madzi ang aing odakimwa. Hena because gidawe do kwak je na gidai nage je ka giwe watch and chi Mam ji goes wa goshma chi giwe watch gidai nage je mami jawab maj ya o which Ojino and Dalganak. And the words are is that it's to look after for every one of you that are here because you travel far, but also to look after you and you go back to your loved ones and to that you have a safe journey, but that you also remember your responsibility and that it wasn't for you. Wasn't for you, we wouldn't be here, but it makes a difference. You do make a difference, and I think there should be little kids that would whisper to each other, and you ask, what did they say? Get vaccinated.